Cerebral aneurysm, detailed explanation. 1. Introduction. A cerebral aneurysm, also called an intracranial aneurysm, is a localized dilatation of an artery in the brain caused by weakness in the vessel wall. While most aneurysms are small and asymptomatic, they are clinically important because of the risk of rupture, which can cause subarachnoid hemorrhage, SH, a life-threatening emergency. Advances in imaging, CT, MRI, angiography have improved early detection. Treatment can be surgical or endovascular, aiming to prevent rupture or control bleeding. Cerebral aneurysm is a major cause of morbidity and mortality in neurology and neurosurgery. 2. Definition. A cerebral aneurysm is defined as, open quote, a localized, abnormal, sac-like or fusiform dilation of a cerebral artery due to structural weakness in the vessel wall, usually at branch points of the circle of Willis, with risk of rupture leading to intracranial hemorrhage. Close quote. 3. Etymology. Cerebral, Latin cerebrum, brain. Aneurysm, Greek aneurysma from ana, up, and eurus, wide, meaning widening or dilation. Thus, cerebral aneurysm literally means brain vessel dilation. 4. Epidemiology, prevalence. 2 to 5% of the general population has an unruptured aneurysm. Rupture incidence, 6 to 10 per 100,000 population per year. Age, most common between 40 to 60 years. Sex, women, men, ratio 3:2. Geography, higher incidence in Japan and Finland. Mortality, ruptured aneurysm mortality rate is 40 to 50%. Among survivors, 50% have permanent neurological deficits. 5. Types of cerebral aneurysm. 1. Saccular, Berry aneurysm, most common 80 to 90%. Small sac-like bulge with a narrow neck, common at circle of Willis bifurcations. 2. Fusiform aneurysm, circumferential dilation of entire vessel wall, often due to atherosclerosis. 3. Dissecting aneurysm, caused by a tear in the intima, leading to blood entering vessel wall layers, associated with trauma or connective tissue disorders. 4. Mycotic aneurysm, caused by infectious endocarditis spreading bacteria to cerebral vessels, leads to weakened wall and aneurysm. 5. Traumatic aneurysm, direct result of head trauma damaging arteries. 6. Causes, congenital vascular wall defects, absence of tunica media and elastic lamina, genetic disorders, autosomal dominant polycystic kidney disease, Ehlers-Danlos syndrome, Marfan syndrome, acquired conditions, hypertension, atherosclerosis, infections, mycotic aneurysms, trauma, hemodynamic stress at arterial bifurcations. 7. Risk factors, modifiable, hypertension, cigarette smoking, excessive alcohol intake, illicit drug use, especially cocaine, amphetamines, atherosclerosis, non-modifiable, age 40 to 60 years, female sex, family history of aneurysm or SAH, genetic syndromes as above. 8. Complications. 1. Subarachnoid hemorrhage itch, life-threatening bleeding. 2. Rebleeding, greatest risk in first 24 to 48 hours. 3. Cerebral vasospasm, delayed narrowing of arteries, ischemic stroke. 4. Hydrocephalus, blockage of CSF absorption. 5. Seizures. 6. Neurological deficits, speech, vision, motor impairment. 7. Death, 50% in ruptured cases. 9. Pathophysiology. Cerebral arteries lack external elastic lamina and vasa vasorum, making them structurally weak. Chronic hemodynamic stress, SBAT bifurcations, endothelial damage. Degeneration of tunica media, loss of smooth muscle and elastin, thinning of vessel wall. Aneurysm forms due to outward ballooning. If rupture occurs, blood enters subarachnoid space, intracranial pressure, vasospasm, ischemia, herniation, death if untreated. 10. Signs and symptoms. Unruptured aneurysm, often asymptomatic. Localized headache, visual disturbances, double vision, ptosis, loss of vision. Seizures, rare. Ruptured aneurysm, sudden severe thunderclap headache, worst headache of my life. Nausea, vomiting, stiff neck, photophobia, seizures, altered consciousness, confusion, coma, focal neurological deficits, hemiparesis, aphasia, vision loss. NESHAB 11. Medical diagnosis, non-contrast CT scan, first line to detect SAH, lumbar puncture. If CT negative but suspicion high, xanthochromia confirms SAH. MRI, MRA for unruptured aneurysms and detailed brain imaging. CT angiography, 3D vascular imaging. Digital subtraction angiography, DSA, gold standard for aneurysm detection and surgical planning. 12. Nursing diagnosis. Risk for ineffective cerebral tissue perfusion related to rupture, vasospasm, acute pain related to meningeal irritation, risk for aspiration related to altered consciousness, anxiety, fear related to diagnosis and prognosis, self-care deficit related to neurological impairment, risk for injury related to seizures. 13. Medical management, stabilize airway, breathing, circulation, ABC, control blood pressure, avoid extremes, nimodipine, calcium channel blocker, reduces vasospasm, anticonvulsants, phenytoin, levetiracetam, analgesics for headache, stool softeners to prevent straining, Valsalva ICP, ICU monitoring for ICP, neurochecks and complications. And 14. Nursing management, frequent neurological assessments, GCS, pupils, limb power, monitor vital signs and ICP, provide calm, quiet environment to reduce stress, maintain airway and oxygenation, prevent complications, seizure precautions, aspiration precautions, administer medications as prescribed, educate patient family about condition, procedures, and lifestyle changes, emotional support and rehabilitation, mobility, speech, ADLs. Treatment options: 1. Surgical clipping, craniotomy and placement of clip across aneurysm neck. 2. Endovascular coiling, catheter inserts platinum coils to induce clotting and seal aneurysm. 3. Flow diverting stents, redirect blood away from aneurysm. 4. Bypass surgery in selected cases. 5. Conservative management, small unruptured aneurysms may be monitored with regular imaging. 16. Psychosocial interventions, counseling for anxiety, depression, and fear of recurrence. Family education about stroke rehabilitation, support groups for survivors of brain injury, vocational therapy for return to work, community-based rehabilitation for long-term support. 17. Prevention, strict blood pressure control, smoking cessation, moderate alcohol intake, avoidance of illicit drugs, esping cocaine, screening of high-risk individuals, family history, genetic conditions, regular exercise and healthy diet, stress management techniques. 18. Conclusion. Cerebral aneurysm is a serious cerebrovascular condition that may remain asymptomatic until catastrophic rupture occurs. Prompt recognition, accurate diagnosis, and appropriate management, whether surgical, endovascular, or medical, are essential to reduce mortality and long-term disability. Nursing care, rehabilitation, and psychosocial interventions play a key role in improving quality of life. Prevention through lifestyle modifications and regular screening in high-risk individuals remains the best strategy. Thank you. Have a nice day.